Good afternoon. We're here today to talk about our emerging transition in the ongoing efforts involving COVID. Here's what I know during this period of time. We have not changed, but the virus has changed. So now we are entering a transition period, and we're here to talk about how to make that transition going forward starting today. Before we talk about what the next phase of this journey will look like, I'd like to address where we are right now and why this transition we are beginning is appropriate. You know, they say the last mile of any trip is the most challenging, and that may be the case here as we come out of the pandemic mode of dealing with COVID. I want to show some headlines around our state that have been very gratifying the last week or so. COVID hospitalizations are declining, and now on both sides of our state. That's great news. We know how hard our hospital workers have been working, and we appreciate their incredible diligence during this period of time. They're going to have continued work as they catch up for other measures, so we need to stand with them in the coming weeks. So these are headlines we like to see. Now, based on trends we're seeing in other countries and states that are further along in the Omicron wave, we fully expect declines to happen here as well, which is also great news. That's why we will no longer need the National Guard. That mission will be ending soon. And why we are removing our requirement that non-elective surgery be postponed. That'll be removed on February 17th. Now, I want to talk about where we are in this curve, and I'd like to show you the models that our Department of Health uses. And we have modeling. I'll show you the graph here. You'll see on the left, of course, that's when we started the COVID journey. We had multiple waves, and of course, the highest wave by far has been the Omicron wave. This shows the hospital data. And you'll see we're just coming over the peak and starting down on February 9th. And now we have projections of a very steep decline leading to, we hope, extremely low numbers by the first week in March. Now, those are projections. They are not absolute certainties, as we know. But the very good news is that we believe this wave has gone up like a rocket, and it's going to come down like a rock. And in fact, that is, we're starting to see that now in the state of Washington. I'd like to show also why we have confidence in these predictions. I want to show you a graph of other countries. And this is why we have confidence that we will continue to see a rapid decline in COVID. This chart shows the experience of the last couple months, or even further than that, of multiple nations around the world. And you'll see obviously the multiple waves coming up to the Omicron wave at the end. But then you'll notice virtually every country has experienced the same thing, which is a very rapid decline in COVID in the last couple of weeks compared to a very rapid increase in the preceding few weeks. This is true for virtually every country that we have data from around the world. This is what gives us confidence that these numbers are going to go down dramatically in the next several weeks. And we're happy to be on that downward slope in this regard. Now, hospitalization rates are still higher today, of course, than in any other time during the pandemic. So as for today, caution is still advised. It remains our best defense. But Omicron clearly has characteristics that will allow us to lift mitigation measures with the weeks to come rather than months. So I'm pleased today to say we are lifting our outdoor masking requirements by February 18th. But today is not the day to lift all of the masking requirements. We are obviously having conversations and an intensive review of what day it will be and when we can do this. It is no longer a matter of if, it is a question of when. And I expect to share that date next week with Washingtonians after we have another week or so of data to give us even a higher level of confidence of where we're going to be sometime in March. Now, as we get ready for this transition, and it is a transition, and all transitions, of course, are challenging for us, change is hard, I want to say two things. First, our decisions in the next several weeks will continue to be based on public health. Public health is our pole star, and we follow it. And the second thing, I want to directly address the millions of Washingtonians who have quietly done so many things in the last 2 years to keep them safe and to help our community arrest this disease. To those families, I say a big thank you for what you've done. You knuckled tight, you didn't give an inch, you kept the faith, and it's made a huge difference on how our state has done. As you know, we have saved thousands of lives in the state of Washington because we have been responsible and because we have followed science. And we are going to continue to do that. And fortunately, the science now allows us to move to a new transition, a period of lifting these requirements. So as we move forward, we are not going to desert each other. We are not going to be stampeded by any political force. We will not be stampeded with other states, what they might do. We are going to make decisions for the public health of Washingtonians based on the science here in our state. And so the day is coming fairly soon when we do not have a broad mask mandate for indoor public spaces or for our schools. And we're going to do that by following the science to make the right decision. We don't make decisions based on social internet culture, wars over masks. We did not require masks for symbolism. We required them because they work. And now we believe we're in a place to transition to a different state. I agree with the CDC that today is not the day to totally eliminate masks, but it is a day that is rapidly approaching. So whatever this off-ramp of the pandemic response looks like, and when it does come in the near future, I want to reassure people that we will be having your safety in mind. I have had on my shoulders the safety of 7 million Washingtonians, and I intend to keep it there. We're going to make a safe transition when it's time. That time is coming soon, in the next few weeks. And as I've said, I will have a date hopefully next week when we have a little more data to make that specific designation.